I'm Michaela Riddell, and I was the clinical trial coordinator for what we believe was the largest randomized controlled trial ever conducted in PNG, the WANTAIM trial. By way of background and rationale for this study, STIs during pregnancy have been associated with both preterm birth and low birth weight in many observational studies over the years. But until now, we've not had a clear evidence to show that these infections cause preterm birth or low birth weight. So the primary objective of WANTAIM was to evaluate if point-of-care testing and treatment of curable STIs during pregnancy reduced the rates of preterm birth and or low birth weight compared to PNG standard care. Our primary outcome was a composite of preterm birth, born early, before 37 weeks, and or low birth weight, less than 2.5 kilos. The trial was conducted at 10 sites in Madang and East New Britain provinces, and we started in 2017, and our last enrolment was 2022. This slide shows the enrolment and retention rates for the trial. We had known birth outcomes for nearly 95% of the women enrolled into the trial. This was despite many hiccups during the trial, such as a large bridge collapse and COVID, both of which impacted recruitment and retention activities. So what did we find? Very importantly, we found that point-of-care testing and immediate treatment overall of curable STIs during pregnancy did not reduce the proportion of babies born preterm or with low birth weight, with the proportions of these outcomes similar for women who were tested and treated and women who were not tested and treated, suggesting that STIs may not be directly responsible for these poor outcomes. We did, however, find that those women who were infected with gonorrhoea and who were tested and treated during pregnancy did have a reduction in the proportion of babies with preterm birth or low birth weight. We found that nearly 60% of women had one or more curable STIs at their enrolment visit. We noted high rates of testing for HIV and syphilis during antenatal care, and we achieved high rates of treatment and cure for those women with an STI. So in summary, the WANTAIM trial demonstrated that testing and treatment of women during pregnancy for STIs did not reduce the proportion of babies born early or with low birth weight. However, for those women who were infected and treated for gonorrhoea, we did see a reduction in babies born early or with low birth weight compared to those not tested and treated. We also demonstrated that PNG IMR can successfully undertake complex trials that are scientifically robust, rigorously conducted, achieve exceptional follow-up, and contribute significantly to medical knowledge and treatment policies. We showed that despite our intervention, there were still high rates of preterm birth and low birth weight, with high maternal mortality and perinatal mortality rates. We also noted high rates of anemia, smoking, and betel nut use during pregnancy. So I leave you with a question. If curable STIs during pregnancy are not directly causing preterm birth and low birth weight, what is? So more research is required. I'd like to thank everybody involved in this study, and especially thank the women, families and communities participating in this research.